show them pictures of a typical urban environment that's not so nice, and you can detect changes in their brainwaves, and that's certainly suggestive that there's a positive influence, or potential positive influence of that kind of environment. We know that there are, we can demonstrate scientifically impacts on the prevalence of obesity, physical activity. We know for people who work in community gardens, for example, we know that they have significantly greater physical activity, less risk of obesity. People who live close to parks, their physical activity is higher. There are studies showing that overall death rates of people who have good access to the natural environment is lower. In lots of studies on mental health effects, anxiety, depression, self-esteem of people who have good access to the natural environment compared to those who don't, showing positive effect on those mental health outcomes. Cardiovascular disease mortality, heart attacks and so on. There's an outcome called health-related quality of life, where people fill out questionnaires reflecting their health-related quality of life. That's a positive influence, and how people generally feel and how well they cope with stressful life events. All of these have been shown to be positively influenced by better access to our natural environment. Now, having said that, these studies are not terribly good on the whole, and I have to admit there are some negative studies there, and the way we measure these exposures and these outcomes could certainly be improved. I think that's an opportunity for us, and we're in fact having some conversations right now with the conservation authorities to see if we can do some work around this. And then we can look at how these pathways happen. We know that it can be just the perception of nature is a positive one, or it could also be that, and we have studies to show this, having good aesthetic natural environments around supports social connectedness, which we know is a very, very positive effect on our health in general, and also supports physical activity, of course. So we think there's a strong positive relationship in a direct sense between the physical environment and our health, but my point is we need to study it more. Now, whenever we talk about relationship between a determinant of health and the health outcome, we always say, well, what's the negative effects? I couldn't think of any, so there aren't any. Which means that, of course, the action we should take, even with poor evidence, is very clear to us. So we need to move there. Okay. The other